It's Friday, November 22nd, and this is the Daily Medical News by MD Edge, where we bring you the top headlines in clinical medicine, plus a closer look at the day's biggest story. I'm Nick Andrews.
And I'm Molly Collegio. Today, a newborn's maternal protection against measles wanes within 6 months.
A presurgical ultrasound is a valuable tool in staging endometriosis.
Enrollment activity is down on Healthcare.gov.
And the nominee for FDA commissioner is facing tough questions on vaping.
Plus, the CDC has issued new guidance for physicians on managing patients with potential vaping-related lung injury. But first, thanks to all of you who've helped us make this podcast better by taking our short listener survey. If you haven't, please take a moment to complete the survey by following the link in the show notes. And now, the news.
Infants born in an area without endemic measles no longer have adequate protection against the condition from maternal antibodies at 6 months of age. That finding comes from a new study published in the journal Pediatrics. Among 196 infants in the study, most of their maternal antibodies had dropped below the protective threshold by 3 months of age. That's well before the recommended age of 12 to 15 months for the first dose of the MMR vaccine, according to Dr. Michelle Science of the University of Toronto, who led the study. In fact, the odds of having inadequate protection against measles doubled for each additional month of age. Dr. Science said the widening gap between loss of maternal antibodies and measles vaccinations leave infants vulnerable to measles for much of their infancy. And it highlights the need for more research in this area to support public health policy.
Before proceeding to surgery for endometriosis, consider using ultrasound to provide staging information. That's the advice from Dr. Matthew Leonardi, a gynecologist at the University of Sydney's Nepean Hospital. Dr. Leonardi and his colleagues retrospectively collected data from ultrasounds, using it to create an American Society of Reproductive Medicine endometriosis stage. They then compared the results with the stage seen at surgery. He presented the findings at the AAGL Global Congress. The analysis included more than 200 procedures performed over about 2 years. Patients underwent deep endometriosis, transvaginal ultrasound, and laparoscopy. Each case received an ASRM score of 0 to 4 at both ultrasound and surgery. Scores of 0 to 2 and 3 to 4 were grouped together for analysis as early or advanced stage. The researchers found it difficult to differentiate individual ASRM stages using ultrasound, but the technique performed better when grouping by stages. Sensitivity and specificity were all above 90% when the stages were grouped as early versus advanced stage endometriosis.
In the latest look at enrollment numbers on the Healthcare.gov website, it looks like fewer people are choosing health plans for 2020. In total, 337,000 plans were selected in Week 3 of open enrollment on the Federal Health Insurance Exchange. That figure is slightly lower than the Week 2 figures this year and slightly lower than Week 3 last year. The enrollment numbers are provided by the Centers for Medicare and Medicaid Services. Overall, for Week 3, more than 550,000 consumers renewed their existing health insurance coverage. About another 186,000 people who were not covered in 2019 selected new plans for 2020. For a complete look at the latest figures, click the link in the podcast notes. The Daily Medical News will be right back after this.
Dr. Stephen Hahn is President Trump's nominee to head the Food and Drug Administration, and he faced some tough questions on vaping at his first congressional hearing. Testifying in front of the Senate Health, Education, Labor, and Pensions Committee, Dr. Hahn said youth vaping and e-cigarette use is a crisis and aggressive action is needed. But when pressed by senators, he didn't commit to any specific action. Senator Patty Murray, a Democrat from Washington, asked whether Dr. Hahn would work to finalize a ban on flavored e-cigarette products. Dr. Hahn said that the final compliance policy is under consideration by the administration, and he is not privy to that process. He said he has not talked to the president about it. He was also pressed by Senator Mitt Romney, Republican from Utah. Senator Romney asked Dr. Hahn if he would take action to ban flavored e-cigarettes even if the president and the White House opposed it. Dr. Hahn cited his pledge as a doctor to put patients first and be guided by science, but stopped short of directly answering the question. Dr. Hahn is a radiation oncologist who currently serves as chief medical executive at MD Anderson Cancer Center in Houston.
And finally today, do you vape? That's one of the most important questions you can ask your patients who present with respiratory symptoms this winter. That's just some of the advice officials at the CDC offered in new guidance to physicians on diagnosing and managing patients with potential EVALI, or vaping-related illness and injury. EVALI remains a diagnosis of exclusion. According to the CDC, there is no specific test or marker for its diagnosis, and clinicians must be guided by their judgment. The CDC advises clinicians to ask about e-cigarette or vaping product use when patients present with respiratory, gastrointestinal, or constitutional symptoms. Influenza testing should be strongly considered to rule out that diagnosis. Clinicians should evaluate suspected EVALI with pulse oximetry and chest imaging. In terms of treatment, corticosteroids may be helpful in treating EVALI but could worsen respiratory infections, so should be used with caution in the outpatient setting. The guidance was published in the Morbidity and Mortality Weekly Report. You can find more details in the report by clicking the link in the podcast notes. And that's it for today's daily medical news. Be sure to catch the newest episodes of CardioCast and the Post Call podcast. CardioCast and Post Call have new episodes dropping each and every Friday. For MD Edge, I'm Nick Andrews.
Our stories this week were contributed by Doug Brunk, Mitch Zoller, Therese Borden, Richard Franke, Michelle Sullivan, Bruce Jansen, Greg Twachtman, Jeff Craven, Tara Haley, Carrie Dooley Young, Eric Greb, Andrew Bowser, Jake Ramali, Heidi Spleet, and Jim Kling. Our editors include Terry Rudd, Mary Ellen Schneider, Catherine Nellist, Catherine Hackett, Mark Lesney, Katie Lennon, Jeff Evans, Gina Henderson, Glenn Williams, Laura McGlade, and Elizabeth Meshkati. Our news team is led by executive editors Denise Fulton and Kathy Scarbeck. And I'm Molly Collegio. If you like what you hear on the Daily Medical News, please leave us a review or rating on Apple Podcasts. And check out the full stories available via the links in the podcast notes. Have a great weekend, and we'll see you next week.